Hi everybody, my name is Mara and I work in physical therapy here at the hospital. Been here about 5 years, and I've noticed throughout my time here some cues that therapists give that I don't always see with all the other staff. So I want to give you guys some insight to some things that we might be able to change to help us and our patients in order to getting up and doing the most safe way. So there's going to be a couple demonstrations you're going to see after this, but you're going to see what I have to say, but I'm going to tell you kind of now a few of the tricks that I use. So first things first is getting someone forward in the chair. So you always want them to have their butt right towards the edge with their feet underneath them, almost so their knees and their toes look pretty even. The next thing you want to do is place a gait belt appropriately. Some people are going to have them right at their middle, which is the best place. That way you can control their center of gravity and where their body goes. So after you've placed the gait belt and they're forward in the chair, you want them to press on the chair side rails so they can press themselves up, or if they're in the bed, you want them to push off the bed. Whatever surface they're on, they should be pushing from. So you have them push up. Once they push up, you're going to give them a cue to bring their nose over their toes. You want them to come forward. When someone brings their center of gravity over their base of support, they have the optimal balance. Once they are there, that's when you wait for them to catch all their balance, make sure they're steady, and then you begin the transfer from there. Those are just some helpful hints from a friendly therapist. Good morning, Missy.
Good morning.
This morning we're going to get you up and we're going to get you over to the commode, okay? So we're going to work on that sit to stand and then we'll get you transferred over. Alright, so the first thing I want you to do is I want you to scoot forward. So your feet are on the floor, nice and flat. Good. One cheek and then the other. Perfect. Alright, so let's scoot your feet back underneath you. Perfect. Your feet are nice and flat and your knees are almost over your toes already. And your hands are in the perfect spot. I'm going to grab that commode and I'm going to put the gait belt on before we go anywhere. I don't want to hurt your fingers. Put this gait belt, I'm going to put it right at your middle, so right at that center of gravity, and I get the most control. Biggest bang for your buck. Put it nice and snug. It's extra big on you because you're just a peanut. Alright, so I'm going to grab you like this. I'm going to keep my feet in front of yours, and on the count of 3, I want you to push up from the chair, and we're going to transfer right over here, okay? Alright. Ready? 1, 2, 3, push, good, and over. Perfect, good work. Good morning, Missy.
Good morning.
How are you today?
I'm doing all right.
Good. My name is Mara and I'm from physical therapy. We're going to do a transfer over to that commode, alright? Good stuff. Alright, I'm going to get the gait belt on you. But first thing I want you to do is I want you to scoot forward so your feet touch the floor. Good. Side to side. Beautiful. Perfect. So let's bring those feet back underneath you a little bit more. Good. So your knees are almost over your toes. Now I'm going to put that belt around you. So what we're going to do is we're going to stand up. Here's what I want you to do. I want you to think about bringing your nose over your toes, and I'm going to have you push from the chair on the count of 3. Okay? And I'm going to keep my foot right here in front of yours just in case that foot decides to slide on us, all right?
Okay.
Okay, so on the count of 3 we'll stand. Ready? 1, 2, and 3. Up nice and tall. Good. Get those hands on the walker. Once you caught your balance, we're going to take some steps over to the commode. Good. Good. I'm going to have you back on up till you feel it behind your legs. Reach back with those hands. Perfect. Go ahead and take a seat. And there you have it. Perfect transfer. Hey everybody, I'm back again. So what I want to talk about is the importance of using a gait belt. Gait belts should be used on almost all of our patients, but there are some exceptions. So we're going to run through a couple of these exceptions or the reasons why you should be placing the gait belt maybe in a different place. There's a lot of patients that have tubes and drains and colostomy bags, all this kind of abdominal stuff. Typically, if I have a patient with that, I'm going to place the gait belt really much higher, almost right underneath their armpits. Now, if that patient ended up having a pacemaker placed, we obviously aren't going to want to put the gait belt there. So that's the kind of patient that we need to make as safe of a transfer without the use of a gait belt. So what we're going to do is make sure everything is set as close as possible, we use the proper language, and we do everything we can. Also, if they have a pacemaker placed, you're going to want to make sure they're not pressing or pushing with that left arm, or we could end up messing with that pacemaker and creating so much more trouble than needed. So, gait belts, incredibly important, should be placed on everybody, but there's always going to be that exception to the rule. So as long as we are consistent with placing them on all the appropriate people and doing that, hopefully we can try to make injuries in the hospital from our standpoint as staff and patient standpoint much less, and have decreased falls and decreased strains, and hopefully we can all go home safely with backs completely intact, which is completely ideal.